Hi friends, welcome to our YouTube channel, one and only pharmacy. So friends, in this lecture we are discuss about Posology chapter with its notes and its explanation. Subject Pharmaceutics second, D Pharmacy second year, presented by one and only pharmacy YouTube channel. So friends, I request you to all please watch this video till the end. Let's start. Friends, in this video we are discuss about posology or factors affecting dose or action of drug, etc. or calculation of formula for calculation of dose. For first is definition, posology. What's posology? It is the branch of medical science. Posology is the branch of medical science which deals with the study of doses of drugs which deals with the study of doses of drug required to produce a specific pharmacological action. Posology is a branch of medical science which deals with the study of doses of drugs required to produce a specific pharmacological action. Posos meaning how much, logos means science. Dose. What is the definition of dose? The dose is defined as quantity of drug which is enough to produce a pharmacological action. The dose is defined as the quantity of drug which is enough to produce a pharmacological action. Factors affecting dose and action of drug. There are 15 factors which affect dose and action of drugs, which are age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, dependence, or tachyphylaxis. So see one by one in details. Age. What's the age affect the dose of drug? Generally, children and old people require small doses of drug than adults. Generally children and old people require small doses of drugs than adults. Age is concerned with the capacity of metabolizing and excreting the drugs from the body. Second, body weight. Heavy weight persons require large dose than normal weight persons. Usually 70 kg is considered as a normal weight of adult for calculating doses. According to weight, the dose of drug varies. If your weight is less, then your dose of drug is less, or if your weight is high, then your dose is large. Third point, sex. Female adults generally requires smaller doses than male due to presence of more fats. Route of administration. Rate of absorption depends upon the route of administration, thus dose differs according to route. For example, intravenous dose requires small dose of drug, intramuscular dose requires then IV dose is small, then SC dose, subcutaneous dose, and oral dose. Means oral route of administration is required high dose, or IV dose of required is small dose. Time of administration. If the drugs are taken on an empty stomach, then absorption of drug is greater, but GIT irritation may occur. If the drugs are taken on empty stomach, then absorption of drug is greater, but GIT irritation may occur. If the drugs are taken after meals, means full stomach, absorption is lesser but no GIT irritation. Presence of disease. Presence of disease may affect the absorption of drug. In diarrhea condition, absorption of certain drug is lesser because drug is going through the or going through with the diarrhea. Genetic factor. Deficiency of certain enzymes may produce hereditary disorders. For example, diabetes mellitus. Drug allergies are also heritable. For example, sulfa allergy and penicillin allergy. Environmental factors. The doses required to produce actions during day and night may differ due to some physiological changes in body functions. For example, dose of phenobarbital means barbitune required to produce a sleep during daytime is higher than dose required to produce sleep at night. Hence, uh, barbiturate drugs are taken only night, not day. Acquired tolerance. It means a large quantity of drug is required to order to obtain a desired effect of drug. For example, morphine, heroin produces tolerance. Idiosyncrasy. It is an abnormal or unusual response given by a drug. For example, in some persons, morphine causes asthma. Rate of elimination or cumulation. Cumulation means accumulation of drug in the body due to the slow excretion, causing toxicity. For example, digitalis, chloramphenicol, etc. Synergism. The simultaneous administration of two or more drugs may result in increase of action. The phenomenon is known as synergism. For example, aspirin and caffeine as an analgesic. Means when at a time we are taken two drugs, means A drug plus B drugs, then equal to their action is more than their addition of individual action. Means plus a 10 plus 2 equal to 20, but in synergism 10 plus 10 equal to 25. Okay, it's a simple phenomenon. It's increase the action. Antagonism. The opposite action of two drugs on the same physiological system is called antagonism. Example, morphine and naloxone. Means these two drugs are opposed to the action of each other and gives the low action on a side of path. Tachyphylaxis. Repeated administration of drug within short intervals of time decreases pharmacological response progressively. This is known as a tachyphylaxis. Ephedrine in the treatment of tachyphylaxis means we are taken such a drug in regularly in large quantity. Then at a one stage, this drugs does not affect the its side of action. Formulas for calculating dose of children. There are two formulas for calculating doses of children. First, Young's formula. What's Young's formula? Child dose equal to age in years upon age in years plus 12 into adult dose. In second formula, Freud's formula. Infant dose age in months upon 150 into adult dose. Thank you guys for watching full video till the end. So friends, if you're new on the channel, so please to like, share and subscribe to our YouTube channel, and don't forget to press the bell icon. Let's see once again what we see in today's lecture. Today's lecture we are discuss Pharmaceutics second chapter, Posology. Posos meaning how much and logos means science. In simple language, posos means it's a branch of medical science which deals with the study of dose or action of drugs. It is the branch of medical science which deals with study of doses of drugs required to produce a specific pharmacological action. Posos means how much, logos means science. Dose. The dose is defined as a quantity of drug which is enough to produce a pharmacological action. Factors. There are 15 factors: age, sex, body weight, route of administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, dependence, and tachyphylaxis. In age, if children and old patients required small doses than adults required a high dose. Body weight, if your body weight is large, then you require a large dose, and if your body weight is small, then you require a smaller dose. Sex, female adults generally require a small dose than the males due to the presence of more fat. Route of administration, intravenous route of administration required small dose because in this type of administration drug is directly enter into the bloodstream. Or second, oral route require a large dose because oral dose we are taken into mouth cavity, they require degradation, some dose where they waste degradation absorption. In this process oral dose require a large dose. Time of administration, if the drugs taken empty stomach, then absorption drug is greater, but GIT irritation may occur. If the drugs taken after meals, full stomach, absorption is lesser, but not GIT irritation. Presence of disease, any disease affect the absorption of drugs such as diarrhea. Genetic factor, deficiency of certain enzymes may produce hereditary disorders. Environmental factors, acquired tolerance, idiosyncrasy, abnormal or unusual response given by a drug. For example, in some persons, morphine causes asthma. Rate of elimination. Cumulation means accumulation of drug in the body due to the slow excretion causing toxicity. For example, digitalis, chloramphenicol, etc. Synergism, the simultaneous administration of two or more drugs may result in increase the action. Any antagonism decrease the action or oppose the action. Tachyphylaxis formulas. Thank you guys.